So we've talked about flat feet, we've talked about high arches, and if you've watched both of those videos, you might be sitting there thinking, well, neither of those sound like me. My feet look pretty normal. My arch isn't flat on the ground, but it's not dramatically high either. I don't have a history of ankle sprains. I don't have that classic heels pain first thing in the morning. And if that's you, you might be thinking, great, I'm off the hook. I have normal feet, so I don't have to worry about any of this. And I want to be careful with that conclusion. Because here's the thing about neutral feet, and this is something that surprises a lot of my patients. Having a neutral foot type does not make you immune to foot pain. It does not mean you can wear any shoe you want. It doesn't mean you never need an orthotic or treatment. It absolutely does not mean that you can ignore your feet. What it means is that you're starting from a more balanced mechanical position, and that's genuinely a good thing. But balance can still be disrupted, and when it is, neutral feet develop real problems, and sometimes the exact same problems we see in flat feet and high arches. My name is Dr. Andrew Schneider, and I'm a podiatrist based in Houston, Texas, with over 25 years of experience treating foot and ankle conditions. This is my third and final video in my Foot Type 101 series, and today we're going to talk about neutral feet, what they are, how they function, what can go wrong, and how to make smart choices about your footwear and your care, even when your foot type is considered normal. Because here's what I've learned in over 2 decades of practice. There's no such thing as a foot that takes care of itself. Every foot type, flat, high arch, or neutral, requires attention, appropriate footwear, and sometimes professional support. The difference is just in the details. So if you've been watching this series and waiting for the video that applies to you, this might be it. Let's get into it. But before we do, if you're finding this helpful, please take a moment to like this video, leave a comment, and hit that subscribe button. It helps other people who are dealing with foot pain find this information, and that's exactly why I make these videos. Let's start by defining what we actually mean when we talk about a neutral foot, because the word normal can be a little misleading. In podiatry, we use a few different terms for this foot type. You may hear it called a neutral foot, a rectus foot, or a stable foot. What all these terms describe is a foot that has a moderate arch, not collapsed and not excessively elevated, and that moves through a normal controlled range of motion when walking or running. The heel strikes the ground and the foot pronates slightly to absorb impact, and then it supinates, rolls back outward, to create a rigid lever for push-off. That cycle done efficiently and within a normal range is what we consider ideal for foot mechanics. And a neutral foot, by definition, is one that performs that cycle reasonably well. The arch is present and functional, the pronation is controlled, the weight is distributed relatively evenly across the foot. It's a well-balanced system. Now, I want to be clear about something. When I say neutral, I don't mean perfect. I mean within a normal range. There's actually quite a bit of variation for what we consider neutral. Some neutral feet pronate a little more, some a little less. Some have a slightly higher arch within the normal range, some have a slightly lower. Neutral is not a single fixed point, it's a zone. And where you fall within that zone can still influence what kind of shoes and support work best for you. So let's talk about how a neutral foot functions biomechanically, because understanding the biomechanics helps explain both the advantages of this foot type and its vulnerabilities. The key advantage of a neutral foot is efficient load transfer. Because the arch is a moderate height and the pronation is controlled, the foot is able to distribute the forces of each step across a broad area. The heel absorbs the initial impact, the midfoot helps transition that force forward, and the forefoot and toes complete the push-off. It's a smooth, efficient sequence, and it means that no single structure is being disproportionately overloaded with each step. That's why neutral feet tend to be more adaptable across different activities and terrains. They're not as prone to the concentrated pressure problems as we see in high arches, and they're not as prone to the excessive motion problems that we see in flat feet. They sit in a mechanical sweet spot that allows for better energy return and more balanced pressure distribution. But, and here's what I want to push back on the idea that neutral feet are worry-free, activity and training still matters enormously. The mechanics of a neutral foot are only as good as demands placed upon them. A neutral foot that's asked to run 40 miles a week or stand on concrete for 10 hours a day, or perform in worn out shoes with no support is going to develop problems. The foot type gives you a better starting position, but it doesn't give you unlimited tolerance for stress. And this is the myth I wanted to dispel today. The myth of normal. Having a neutral foot type does not mean your feet are invincible. It means they're well positioned, but they still need to be taken care of. So what kind of problems can neutral feet develop? Let me walk you through the conditions I see most commonly in patients who come in with neutral foot types. Plantar fasciitis is at the top of the list. I know, we talked about plantar fasciitis in both the previous videos, but here it is again. That's because plantar fasciitis is genuinely one of the most common conditions I treat, and it does not discriminate by foot type. In neutral feet, plantar fasciitis typically develops not because of structural problems, but because of overload, too much activity, too quickly, in shoes that aren't providing adequate support. The plantar fascia gets more stress than it can handle. It becomes inflamed, and that classic heel pain develops. Achilles tendonitis is another very common presentation in patients with neutral feet. The Achilles tendon connects the calf muscles to the back of the heel and is under significant load with every step. In neutral feet, Achilles tendonitis is often related to training errors, ramping up activity too quickly, doing too much heel work, or wearing shoes with insufficient heel cushioning. It can also be related to calf tightness, which is something I see constantly in patients of all foot types. A tight calf puts more tension on your Achilles, and over time, that tension leads to inflammation and pain. Stress injuries are a significant concern for neutral feet, particularly in active individuals, because neutral feet are often used for higher volume activity. Running, hiking, sports, they can be subjected to the kind of repetitive loading that leads to stress reactions and stress fractures in the metatarsals or the heel bone. The foot type itself isn't the primary cause here, but the activity level combined with the inadequate footwear or recovery can push a well-functioning foot past its limits. Fat pad syndrome is something that doesn't get talked about enough. It's more common than people realize. The heel has a natural fat pad that acts as a cushion with every step. Over time, particularly with age and with high impact activity or with prolonged standing on hard surfaces, that fat pad can thin and atrophy. When it does, the heel bone is much closer to the ground, and every step becomes painful. Patients describe it as a deep bruised feeling in the heel that's different from the sharp morning pain of plantar fasciitis. Fat pad syndrome can affect any foot type, but I see it frequently in active patients with neutral feet who have been on their feet for years without adequate cushioning. Neuromas, specifically Morton's neuroma, can develop in neutral feet, particularly in people who wear narrow or pointed shoes or do a lot of forefoot loading activities like running or dancing. A neuroma is a thickening of the tissue around one of the nerves between the toes, and it causes burning, shooting, or electric pains in the forefoot. It's not exclusively a high arch problem, as I mentioned in the last video. It can develop in any foot type when the forefoot is subjected to chronic compression or irritation. And finally, general overuse injuries. Tendonitis in various tendons around the foot and ankle, bursitis, capsulitis in the toe joints. These can all develop in neutral feet when the demands placed on the foot exceeds its capacity to recover. This is especially true as we age, as training volume increases or as body weight changes. The common thread through all these conditions is not a structural defect in the foot. It's a mismatch between what the foot is asked to do and the support and recovery it's being given. And that's actually good news, because it means these problems are largely preventable with the right approach. So how do you know if you have a neutral foot? Let me give you a few ways to assess this. The wet test is your starting point. Wet the bottom of your foot and step onto a piece of cardboard or paper bag and look at the imprint. A neutral foot will leave a footprint that shows a heel, a moderate curve along the inside of the foot, not a complete gap like a high arch, but not a full solid imprint like a flat foot. And the forefoot, you'll see a distinct but not dramatic arch. That moderate curve is the hallmark of a neutral foot. Your shoe wear pattern is another useful indicator. Neutral feet tend to wear shoes relatively evenly, and you'll see wear across the ball of your foot and the heel without dramatic concentration on either the inside or outside edges. If your shoes are wearing evenly, that's a good sign your mechanics are reasonably balanced. Gait analysis is the most accurate assessment, and it's something I recommend for anyone who is active, who has foot pain in the past, or simply curious about how their feet are actively functioning. Even neutral feet can have subtle asymmetries or compensations that aren't visible to the naked eye, but show up clearly in a gait analysis. Knowing exactly how your foot moves gives us the information we need to make precise recommendations, not just about shoes, but about orthotics, exercises, and activity modifications. And I want to say something about self-assessment in general. The wet test and shoe wear patterns are useful starting points, but they're not a substitute for professional evaluation. I've had patients come in convinced they have neutral feet based on a wet test, only to discover in a gait analysis they have a subtle but significant overpronation pattern that's been contributing to their knee pain for years. The foot is a complex structure, and what you see on the surface doesn't always tell the whole story. Now let's talk about shoes, because this is where I see neutral-footed people make the most mistakes, and the mistake is usually not what you'd expect. The most common mistakes I see in people with neutral feet is actually under-supporting their feet. Because they've been told they have normal feet, they assume they can wear anything. They buy whatever looks good, whatever's on sale, whatever their friend recommended. They don't think about arch support or heel counters or midsole density, and for a while, that might be fine. But over time, especially as activity level increases or the natural cushioning of the foot begins to diminish with age, that lack of attention to footwear starts to show up as pain. For neutral feet, the best category of shoe is generally a stability shoe. Now, I know that might sound counterintuitive. Stability shoes are often associated with flat feet and overpronation, but a good stability shoe is not about controlling excessive motion. It's about providing a balanced combination of support and cushioning that works well for a foot that's already moving efficiently. A stability shoe gives a neutral foot the structure it needs to maintain the efficiency over long distances and long days, without being so rigid that it interferes with normal motion. What you're looking for in a shoe for neutral feet is a firm, but not rigid heel counter, a midsole that provides meaningful cushioning without being so soft that it destabilizes the feet, and a toe box that gives your toes adequate room to function naturally. If you want a shoe that feels supportive without feeling like it's fighting your foot's natural movements. What you want to avoid is footwear that provides no support at all. Flat sandals, worn out sneakers, thin-soled casual shoes. They're fine occasionally, but if they're your primary footwear for long days on your feet or for exercise, they're not giving your neutral foot the support it needs to stay pain-free over time. I also want to address the barefoot and minimalist shoe trend, because it comes up frequently with patients who have neutral feet. The argument for minimalist footwear is that it strengthens the intrinsic foot muscles and promotes more natural movement patterns. And there's some truth to that. A neutral foot is actually the foot type best suited to experiment with minimalist footwear, because it's starting from a more balanced mechanical position. But, and this is critical, the transition has to be gradual. Going from conventional supportive shoes to a minimalist footwear overnight is a recipe for injury, regardless of your foot type. If you're interested in exploring minimalist shoes, do it slowly, incrementally, and ideally with guidance from a professional who can monitor how your foot is responding. Now let's talk about when neutral feet need more support than shoes alone can provide. The first scenario is increased training volume. If you're a runner who's ramping up mileage or an athlete who's increasing the intensity or frequency of training, your feet are being asked to do significantly more work. Even a neutral foot has limits, and when these limits are being pushed, additional support in the form of orthotics can be help to distribute the load more efficiently and reduce the risk of overuse injuries. The second scenario is aging. As we get older, several things happen to our feet that affect even the most mechanically sound foot type. Fat pads in the heels and the ball of the foot thin out. The tendons and ligaments lose some of their elasticity. The muscles weaken. The arch, which was perfectly neutral at 30, may show signs of flattening at 50 or 60. This is a normal part of aging, but it means that the support needs of a neutral foot change over time. What worked at 30 might not be enough at 55. The third scenario is weight change. Significant weight gain increases the load on every structure in the foot with every single step. A neutral foot that was functioning perfectly at one body weight may begin to show signs of stress at a higher body weight, not because the foot type has changed, but because the demands have increased. In these situations, additional support can make a meaningful difference in comfort and in preventing these development of the more serious conditions. The fourth scenario is injury history. If you've had significant foot or ankle injury in the past, a bad sprain, a stress fracture, a tendon injury, the mechanics of that foot may have subtly altered, even after the injury has healed. Scar tissue, compensatory movement patterns, and residual weakness can all affect how a previously neutral foot functions. In these cases, orthotics and targeted rehabilitation can help restore more efficient mechanics. And the fifth scenario is occupational demand. If your job requires you to stand or walk on hard surfaces for extended periods, healthcare workers, teachers, retail workers, tradespeople, your feet are under sustained loads for hours at a time. Even a neutral foot would benefit from additional cushioning and support in these situations. I write notes for patients regularly recommending supportive footwear as a workplace accommodation because the difference it makes in daily comfort and long-term foot health is significant. So when do orthotics make sense for neutral feet? The answer is more often than people think. Custom orthotics are not just for flat feet or high arches, they're for any foot that's experiencing pain or dysfunction that isn't being adequately addressed by footwear alone. For neutral feet, orthotics are the most commonly used for repetitive stress injuries, plantar fasciitis, Achilles tendonitis, and metatarsalgia, where the goal is to fine-tune the load distribution and reduce the stress on the affected structure. They're also used for sports performance, where even small improvements in mechanical efficiency can make a meaningful difference. And they're used for occupational demands, where the goal is simply to keep a hardworking foot comfortable and healthy over a long career. Over-the-counter insoles can be a reasonable starting point for neutral feet, particularly for mild symptoms or for people who want to add some cushioning to a shoe that doesn't have enough. But for persistent pain, for high-volume athletes, for patients with specific mechanical issues identified on gait analysis, custom orthotics provide a level of precision that over-the-counter products simply can't match. I want to take a moment to talk about something that I think is really important, and it's the concept of proactive foot care. In my experience, the patients who do best over long term are not the ones who come in after something's broken down. They're the ones that come in before it does. They get evaluated, they understand their foot type, they make informed choices about their footwear, they address small problems before they become big ones. Neutral feet in particular tend to get neglected in this regard because they don't have the obvious structural characteristics that prompt people to seek evaluation. Flat feet are visible, high arches are visible, but a neutral foot looks fine. So people assume it's fine and they don't think about it until something hurts. Don't wait until something hurts. If you're active, if you're on your feet all day, you have foot pain in the past, or you're simply curious about how your feet are functioning, come in. Get evaluated. A gait analysis takes very little time, and the information it provides can guide years of better decisions about your footwear, your training, and your foot health. Here's the takeaway I want you to leave this video with. The right shoe matters no matter what foot type you have. Neutral feet are not exempt from that rule. A neutral foot is in the wrong shoe, a shoe that's worn out, too flat, too narrow, or simply not appropriate for the activity will develop problems over time. And a neutral foot in the right shoe with appropriate support and cushioning for the demands being placed on it will serve you well for decades. Foot type is not destiny. It's information. It tells you where you're starting from and what your vulnerabilities are, and what kind of support is the most appropriate for your specific mechanics, whether you have flat feet, high arches, or a neutral foot. The goal is the same: keep the foot functioning efficiently, distribute the load appropriately, and address problems before they become chronic. Your feet carry you through everything, every step of every day. They deserve attention, appropriate footwear, and professional care when they need it. Don't take it for granted just because they look normal. If you're not sure what your foot type is, or you've been dealing with foot pain that you haven't been able to figure out, come in for a visit. A gait analysis can tell us exactly how your feet are functioning and what they need. The link to request an appointment is in the description below. And if you found this series helpful, please take a moment to like this video, leave a comment, and share it with someone who might benefit from it. Make sure you're subscribed so you don't miss future videos. I cover everything from common conditions to treatment options to practical advice you can use every day. Thank you so much for watching, and have a great day.